Welcome to the MagView instructional videos for technologists. The videos are split into 4 parts, so specific information that is needed by the technologist can be accessed quickly. The first video, this one, is an introduction of the MagView application to the technologist. This is the home page that the technologist, after she logs in, will see. You'll be using as a technologist the patient's icon, here, this button, and the work list. From time to time, you may be asked to run a day sheet, which you will do in Clarity reports, and those instructions are in the clerical video catalog. Using the patient search button, a pop-up comes up and you can search using a patient's name. If we search their PHN, we will be able to find that specific patient. But if a patient name, either last name, first name, or both, it'll bring up all the possibilities. Date of birth is another lookup criteria that you may use. By tapping on these top bars, you can sort the lists if you have more than one patient. There's also this PHN box, quick lookup box, that's handy. If you have the PHN and you just want to key it in here and enter, it'll come up with the patient's file. Just skipping over here, the recently selected patients will give you a list of about 8 to 10 patients that you recently accessed. Now going into the work lists, the work list that you will be using the most will be the technologist work list. These patients have been arrived at your center through the RIS. RIS then sent a message, an HL7 message, to MagView, and MagView then displays the name here. At that time, the clerk or the tech, depending on your center, will then start the tablet, the iPad survey, and have the patient fill that out. When they're completed, they will then go on to be ready for their exam. The clerk can then put a note here, if she likes, about the patient being ready, that they have completed the tablet. But it's not mandatory. It's just a convenient way to communicate between the clerks and the techs. So once you bring the patient in the exam room, make sure you select the correct patient from this work list and that it matches the patient's name on your acquisition workstation as well. Another work list is the pending report work list. This is a work list that holds patients that have exams that are ready to be read. Most likely in your center, your radiologist will be accessing this list via their PACS work list. We've integrated both MagView and the PACS so that they work together, and the MagView will auto-launch when that patient is selected in PACS. The Reports on Hold work list is a work list that you should check from time to time as a technologist. If you notice any patients that require repeats because of perhaps a positioning issue or blur, anything like that. So keep an eye on this work list. The clerks will be calling these patients to come back and get the image done if that's what the reason is for the report being put on hold. Waiting for priors. This is a work list that indicates that these patients have had priors outside of the program. So this is a question that you do ask in the exam room, and when you click yes, that the patient did have an exam outside of the screening program, it immediately will route all these patients to this work list.